Hello everyone, welcome to my channel Homeopathy Super Sessions by Dr. Jarvis. Today I'll be doing the second part of drug proving as per the aphorisms given in Organon, 6th edition. In the older prescriptions, the dangerous effects of the medicines were produced due to the ingestion of excessively large doses. So basically in the old school's prescription, the effects of the drugs had dangerous effects because they were taken in large excessive doses. These effects were not seen in the beginning, but at the end of the disease, where the symptoms were exactly opposite in nature to that first appeared. But however, these effects were not seen at the beginning, but they were seen at the end of the disease, and the symptoms were exactly of an opposite nature than what appeared first. These symptoms are the very reverse of the primary action. So these symptoms are exactly opposite of the primary action. The secondary action is not seen when moderate doses are administered on the healthy body, and from small doses, it is not seen at all. So therefore, in drug proving, it said that the secondary action is not seen when moderate doses are administered, or even from small doses, it is not seen at all. So basically in drug proving, what are we doing? We are proving a drug on a healthy individual. That means what? We are only seeing the primary action of the drug. That is the action of the drug on a healthy individual. So the only exception is that of a narcotic substance. So the only exception is that in narcotic substances, you do not see primary action, but you see the secondary action. Here, the primary action takes away the sensibility and sensation, sometimes even the irritability. So why don't we see the primary action? Because it takes away the sensibility and sensations and even the irritability. It frequently happens that the secondary action, even in moderate experimental doses on the healthy bodies, an increased sensibility and even a greater irritability is observed. So therefore, it says that for the narcotic substances, when given in moderate doses, it causes the secondary action of increased sensibility and increased irritability is observed. Thus, when moderate doses are given, with the exception of narcotic substances, we only observe the primary action. As I just told you that in drug proving, with the exception of narcotic substances, we are seeing only the primary action. That is the action of the medicine on the vital force. That is, we observe those symptoms which are brought about by the deranged vital force when the medicine is administered on a healthy person and it develops a morbid state for a longer or shorter duration. So the symptoms are observed. And what symptoms are observed? Naturally, the symptoms of the deranged vital force when the medicine is administered to a healthy person and a morbid state is there or a disease state is there, which lasts for either a short time or a long time. However, it may so happen that in some medicines, an alternating state is observed. That is, alternating states of the primary action. So, Dr. Hahnemann tells us that besides the primary action, you may also get alternating states of the primary action. That is, alternating states also may be observed during the process of drug proving. So, you get primary action and you may also get the alternating state, which is nothing but the alternating state of the primary action. Thus, some symptoms are produced by medicines more frequently, others more rarely in few persons, and only in a very few healthy bodies, which are termed as idiosyncrasies. So now, Dr. Hahnemann gives us the introduction or the definition of idiosyncrasy. So he says that when we administer the drug to be proved on healthy individuals, well, some may give more symptoms, others may have rarely a few symptoms which are seen in a few persons, and some symptoms are there which are only seen in very few healthy bodies, which are termed as idiosyncrasies. Now let us see the definition of idiosyncrasy. Aphorism number 117 defines idiosyncrasy as those peculiar corporeal constitutions which, although otherwise healthy, possesses a disposition to be brought into a more or less morbid state by certain things which seem to produce no impression or change in many other individuals. So there are those peculiar corporeal constitution. That means what? these idiosyncratic people have a peculiar corporeal, meaning physical constitution, but otherwise, although they are healthy, but they possess a disposition to be brought about in a more or less morbid state by certain things. So therefore, though they are healthy, they have a disposition to be affected by certain things which seem to produce no impression or change in many other individuals. Or the same substance, when given to other individuals, they do not affect them, but they only affect those people who have these peculiar corporeal constitutions, which are otherwise although healthy. Now, examples stated in footnote 95 are of idiosyncrasy. Some persons are apt to faint from the smell of rose and may fall into many other morbid states. So therefore, it says that some people may faint from the smell of rose. Now, if 4 people are there and each one of them smells a rose, well, nothing may happen to that. But if the 5th person may smell, if it's idiosyncratic, then he will faint. So therefore, it says those peculiar corporal constitutions, which otherwise, although healthy, possesses a disposition to be brought into a more or less morbid state by certain things which seem to produce no impression or change in many other individuals. Second example is sometimes dangerous states from the partaking of mussels, crabs, or the roe of the barbel. So people who are non-vegetarians and they eat these mussels or the shellfish, crabs, and the roe of the barbel. Roe is nothing but the eggs of a particular type of fish. So if they eat that, they may also produce certain symptoms. But other people who eat it will not produce any other symptoms. So only idiosyncratic people who will intake the mussels, crabs, or roe of the barbel will have some symptoms. And another example is that from touching some leaves of some kind of sumac, etc. So that means what? Touching the leaves of a particular type of a tree. Sumac is nothing but a particular type of a tree. So by touching these leaves, majority of the people will not develop any symptoms. Only an idiosyncratic person may develop some symptoms. So furthermore, Dr. Hanneman says 2 conditions are required for idiosyncrasy. Number 1, the inherent power of the influencing substance, and second, the capability of the vital force that animates the organism to be influenced by it. So there are 2 conditions which are required. Number 1, the inherent power of the influencing substance. So whatever substance is there, it has to have an inherent power which will produce certain symptoms in an idiosyncratic person. And second, the capability of the vital force to be influenced by it. So the vital force also should be influenced by it. So number 1 important condition idiosyncrasy are that the inherent power of the influencing substance, and second, the capability of the vital force to be influenced by it. The derangements of health in the so-called idiosyncrasies cannot be laid to the account of these peculiar constitutions alone. So therefore, Dr. Hanneman says that whatever derangement of health is taking place in the so-called idiosyncratic people, they cannot be accounted only by their peculiar constitution. It must also be ascribed to these things that produce them or making the same impression on all human bodies. But also it has to be also has to be ascribed to the power of the, or rather to the inherent power of the influencing substance. These agents do not actually make this impression on every healthy body. So as you all know, everybody is not idiosyncratic. It's a very rare condition. Out of 1,000 people, maybe 1 person may be idiosyncratic. Therefore, it says these agents do not actually make this impression on every healthy body. It is shown by the fact that when employed as remedies, they render effectual homeopathic services to all sick persons. So therefore, he says, Dr. Hanneman says that when in drug proving, you may get 1 or 2 symptoms only exhibited by 1 prover, and from the whole group, no other prover has exhibited this symptom. So therefore, this prover who has exhibited this symptom was extremely susceptible to the influencing substance, And because of his peculiar corporal constitution, he developed an idiosyncrasy, and he had developed these one or two symptoms which no other prover had developed. So therefore, such symptoms become very useful to serve the sick person. That means what? On symptom similarity, if you have this peculiar, rare, strange, uncommon symptom, which this idiosyncratic person has developed during drug proving, and in a sick person, if the same symptoms are there and you administer the drug, the person will be cured. So therefore, they say that these render effectual homeopathy services to all sick persons. Thus, the morbid symptoms, similar to those they seem to be only capable of producing in so-called idiosyncratic individuals. So therefore, as I told you, in a big group of drug proving, you may only get one person who is idiosyncratic and who will display such morbid, characteristic, peculiar, uncommon, and rare symptom. Every medicine exhibits a peculiar action on the human body. Thus, different medicinal substances may not produce exactly the same action. That is, they produce their own unique, peculiar action. So, different medicines are there which are proved, and each of them has its own inherent power to produce its own peculiar action or the set of symptoms. That means if a drug A, B, and C is there, and if they are proved on the healthy prover one by one after the another on different provings, it will be seen that drug A has its own peculiar set of symptoms, drug B also has its own peculiar set of symptoms, and drug C also has its own peculiar set of symptoms. No doubt, there may be some common symptoms which run throughout all these drugs A, B, and C, but the peculiar symptoms will help us to identify or differentiate drug A from B from C. So therefore, there are no surrogates in homeopathy. Surrogates mean substitute. That means what? If the totality, for example, you've taken and a drug A is there, and the drug A is not there with you, you cannot give drug B. So whatever is indicated according to symptom similarity, that has to be given. There are no substitutes in homeopathy. That is why there are no surrogates in homeopathy, what Dr. Hahnemann has to say. Why are there no substitutes? Naturally, because it will not match the symptom similarity. Thus, this is compared to different species of plants and mineral substances. So therefore, he says that Dr. Hahnemann has compared, he just has different species of plants and mineral substances are there. Each has its own characteristic property. Similarly, each drug also has its own characteristic property, and you cannot differentiate, or rather you cannot substitute one for the other. Every species of plant differs in external form, mode of life and growth, in its taste and smell from every other species and genus of plant, which I've just told you. As certainly as every mineral and salt differs from all others in external as well as internal physical and chemical properties. Same thing for the minerals, because each mineral is different in its external property as well as in the physical and chemical properties. So each mineral has a different external appearance as well as a different physical and chemical properties. Therefore, you can differentiate one mineral from the other. Thus, they certainly differ among themselves in their pathogenetic as well as their therapeutic effect. So naturally, the minerals or the salt or the plant, whatever kingdom you have taken the drug to be proved, it will differ in its pathogenetic, that is the disease producing, as well as the therapeutic effect, that is the curative effect. Each of these drugs, each of these substances produce alterations in the health of the human being. So naturally, each of the substances will affect the vital force and some symptoms will be exhibited. This is seen in a peculiar, different, yet determinative manner so as to prelude the possibility of confounding one with the other. So therefore, each substance has a peculiarity of producing a certain peculiar set of symptoms. And these set of symptoms are determinative of that particular substance which we are proving. So therefore, there's no possibility of getting confused by one substance with the other, because each one of them will have its own distinguished characteristic peculiarity of symptoms. Therefore, medicines on which depends man's life and death, disease and health, must be thoroughly and most carefully distinguished from one another. So therefore, he said, excuse me, that medicines upon which depends man's life and death. So with the help of medicines, we can maintain one's life as well as prevent death. And also we can maintain a healthy life and prevent disease. So therefore, he says the medicines must be thoroughly and carefully distinguished from one another. That means what? You have to do nothing but individualize the medicine. So homeopathy is nothing but individualizing the patient, the medicine, the potency, and the repetition. It has to be tested by careful, pure experiments on the healthy body for the purpose of ascertaining their powers and real effects. So how will you find out? How will you carefully distinguish one from the other? By testing it carefully by pure experiments on the healthy body for the purpose of ascertaining the real powers and real effects. Then only we will obtain an accurate knowledge of them. So by doing so, then only we'll be able to have a proper knowledge or an accurate knowledge or a precise knowledge of the drugs. This will enable us to avoid any mistakes in the employment of the disease. So once we have a proper knowledge, once we have a confirmatory symptoms of the drug which has been proved on a healthy human being, then naturally we will not make any mistake while employing it in the disease condition. It is only by correct selection of them that the health of the body and of the mind can rapidly and permanently restore. So in a disease condition, it is only by the accurate selection of the remedy by the homeopathic physician, according to the totality of symptoms, taking into account the law of similars, has to be taken in order to annihilate and restore the health in a disease of an disease individual. So once that is done, the health can be rapidly and permanently be restored. So that's all for this lecture or this video. Part 3 will be coming up soon. And I hope you enjoyed this video. Please do stay tuned for more. Thank you.